Hi everyone, it's me, Mindy. I'm going to do a YouTube video today talking about the pros and cons of being an aesthetic nurse injector or like a cosmetic nurse. So one thing that is really great is you get to work independently. You have more autonomy, I would say, versus when you're at like a traditional like hospital setting, because during that time you have your role, you have your tasks, you're part of a team. It really just depends, especially if you actually are working independently, like solo, you have your own practice and all of that, or if you are working at a med spa that's established, things of that sort. But I will say you do have autonomy treatment wise. Another pro is if you are working within a med spa or like a clinic or plastic surgery's office, there is that collaborative teamwork aspect. So that's really great because you will be able to learn from your other colleagues, vice versa, but you'll always have some sort of support. I would say there is work-life balance. So the hours are pretty much set. If you're working for yourself, I mean, you can make your own hours. You could go in for 4 hours or a full day and see as many or as little patients depending on what it is exactly that they're needing and wanting. But the med spa that I currently work at, we are open from 10 to 5. So I'm typically there a little bit before 10 and then I stay a little bit after 5. Those will be your kind of like shifts or hours versus traditional hospital worker. You will be doing, either 8, 10, or 12-hour shift. Anyways, those are typically your hours as an aesthetic nurse. Going back onto the work-life balance, so it is however you see it. So if you are working full time Monday through Friday or 5 days or so a week, sometimes people find that that is their work-life balance. They're working the 5 days a week and then they have their 2 days off for vacation and whatnot. Other people will see as many patients as they can in 2 days, 3 days, and that's still considered like full-time and whatnot. It really just depends on your chapter in your life and what your needs are. So for me, I am used to working 3 shifts in the hospital. So as an aesthetic provider, I work anywhere between 3 to 4 shifts a week as well, even though the hours, like I'm not there 12 hours per se, but I'm there a good chunk of time and seeing a good chunk of patients, at least I would say 8 to 9 patients a day. One of the cons I would say maybe to aesthetics is it really depends on where you're working at, right? Are they a chain? Are they a plastics office or derm's office? Some places don't give you the option for 401k or benefits, PTO, things like that. I am fortunate enough to work somewhere where it is provided for me, but other places I know like you have to do those things on your own. One of the cons is going into aesthetics, you're gonna have to find your own benefits and do your own research and get your own health insurance. And the pay really varies. So especially when you're coming into it in the very beginning, you are still a new injector. You're not in that, I guess, advanced injector role, because if you have less than 2 years of experience, they're definitely not going to compensate you as well because you have a lot of liability. You're still a beginner. You're still in your very beginnings. Pay really ranges. So sometimes you will get a commission pay rate, sometimes you will get an hourly pay rate, sometimes it's a combination of both. Some cases though, like I will say my very first year being an injector, I made less than 40K. That is like not enough, right? But I also was doing it on the side. Just keep that in mind. I was just doing it on the side. I was not seeing as many patients as frequently as I am now, being more full-time and more established in aesthetics. But yeah, it's whatever you make of it. So the more you work, obviously, the more you can earn and the more you can make. I know that with aesthetic nursing, it can really range anywhere between 60K to over 100K. So most aesthetic nurses who have a few years under their belt, they're making in between there. So, but I would say if I looked at my hourly, it can be anywhere between $30 to $50 an hour that I'm making, which kind of is in that range of being a registered nurse in the hospital as well. I know like other places, they may give you like bonuses and things like that. They have different metrics, so it really all depends. The pay range though really varies, like I said, if you're hourly or commission or both. Another con, I guess, would be your trainings you will have to pay out of pocket. It's not like the hospital where they send you to go get your BLS, ACLS, PALS training. The med spa that I work at is a training academy, and then we have a mentorship program as well. All of the providers at my place of work, we all do continued education. We're always pouring into ourselves, investing in ourselves, paying for trainings. My mentor and my boss, she also flies in people. She is also a trainer for Allergan. I would say that's one of the cons, is like you will have to cough up a good chunk of money for trainings, because these trainings will go, it's well over $1,500 and up for a few hours, to the ones that are like 1, 2, 3 days. I think the most that I've ever paid for a training was maybe close to 5K, and that's pretty common. I think that was for like a cadaver lab. But yeah, anyways, so that is one of the cons as well. For your continued education, you have to kind of be a go-getter, and you have to really put in the effort and the money back into yourself. But yeah, so those were some of my pros and cons in the industry. I'd love to hear what yours are. Share them in the comments below. And don't forget to subscribe to my YouTube channel, like this video, follow me on my other social media. On my Instagram, I have TikTok as well. And I can't wait to see you in my next video. Thanks for watching. Bye.